Hello, I'm Dr. John Preston. I'm with Alliant International University in San Francisco. And in this brief video, I want to talk to you about some key factors in the treatment of ADHD. Attention deficit hyperactivity disorder affects between 7 and 8% of children. It has been clearly established that even though a third of kids that have ADHD will outgrow this late in adolescence, early adulthood, two-thirds continue to have ADHD symptoms well through adolescence and for the rest of their life as adults. And the impact of untreated ADHD is very significant. Lots of focus has been aimed at trying to improve academic performance, and obviously this is a very critical issue, but it's important to really underscore that ADHD is a pervasive problem. It affects children 24 hours a day in terms of especially family relationships and social relationships. These kids have trouble with impulsivity. They don't have good sense of interpersonal boundaries. They bug the daylights out of other kids. They're kind of intrusive. They frequently are not chosen to be on sports teams. They're rarely invited to spend the night with friends and so forth. And so in addition to failing academically, if you have untreated ADHD, the consequences in terms of social adjustment are significant. And most of these kids will develop very severe problems with low self-esteem and may develop depression. One thing that happens when teenagers develop depression and low self-esteem oftentimes is they turn to substance abuse. And there's two good studies that have shown that by the end of adolescence, those teenagers that have ADHD but they have not been treated, compared to ADHD teenagers who were treated with stimulants, the substance abuse rates are twice that in the group that did not get treated. Another significant outcome. There's two important points I want to make about treatment with stimulants. First is all the stimulants operate by increasing the availability of dopamine. The picture on the left is a metabolic brain image showing what looks like a hole in the left frontal lobes, but it's not actually a hole, but it's actually an area where there's marked decreased metabolic activity. The slide on the right, the photograph on the right, however, shows 1 hour after taking the stimulant that has become completely normalized, and this has been seen in a number of different kinds of brain imaging studies. The first point I want to make is that not all stimulants are created equal. They all increase dopamine, but in 1996, Greenhill and Associates were able to demonstrate that in two-thirds of children, there will be one stimulant that actually is significantly better than the other stimulants. Stimulants fall into three categories: methylphenidate, which is Ritalin, and Ritalin clones like Concerta and Metadate, for instance; dextroamphetamine, which is Dexedrine; and then amphetamine, which is Adderall. Systematic trials with each one of these for a period of a month in two-thirds of kids will show that one class is significantly better than the other. This is a strategy that's not used very much, but it's a high-yield strategy. If you look at those kids that actually do a lot better on one particular drug, they have a trial on each category of these medications. If you look at the gains they have, and then you multiply that times the years of their life as children, teenagers, and adults, the outcomes can be significantly positive for these kids. The other thing that's been found in the now famous MTA study was that if you compare treatment given by psychiatrists, child psychiatrists, to those kids that are treated by pediatricians, there's a significant difference. The kids that are treated by psychiatrists have much better outcomes, and a single factor that makes a difference is they use doses that are approximately twice the dosing used by pediatricians. For reasons that are not entirely clear, pediatricians tend to be conservative and treat this disorder by somewhat lower doses, and the outcomes are not nearly as good. I'd like to strongly suggest that this is a disorder for which there is a treatment that is excellent. In fact, the outcomes in treating ADHD with stimulants are among the best in terms of outcomes in all of psychiatry. It's a disorder that, if it's not treated, has huge implications for social adjustment as well as academic success or failure. And finally, if there are treatments that are excellent, as these are, then why not do it the right way? And the right way appears to be doing systematic trials on each of the three categories and seeing which class of drugs works best for each individual child. And then, as long as it's well tolerated and there are not significant side effects, then to use aggressive dosing, and this is where you have the best outcomes. Okay, thank you for listening.